Pamela is asking, where does the living will and the dementia directive come in? And she's also asking, what is the best time to do a pulse and a MOLST?
Okay, so the first question, there are different, so in general, dementia obviously is a big medical problem in the country. 7% or more of people over the age of 65 have dementia. And so there are specific directives for dementia or early, because dementia has various stages that you go through. Some people can actually do a dementia healthcare directive if they're early in the early stages of dementia and they still have agency and they can make those decisions. Uh, so most directives are not directed exactly at dementia, but the directive that we have addresses the fact that if you do lose agency, what you would specifically want. So to answer the question, one, there's the general medical directive for people who don't have dementia, and then there's a separate set of directives that are available for patients that have early stages of dementia. Or you can also fill those out and have that as a second set of directives, meaning you have general medical directives, and then you could have another set of directives that don't disqualify the other directives. In the case of dementia, this is what I want to have done. So you can have those two sets of directives if you so choose. But usually people have one trusted medical decision maker or their power of attorney for healthcare, and they may have a person to be a backup if that person's not available. Does that answer the question? And then the other question was about the pulse and MOLST and when does that become important? So the pulse and MOLST, the physician's order for life-sustaining therapy, often comes into play when patients are either in hospice or have they're at a course in serious illness, whether it's from end-stage renal disease, congestive heart failure, cardiac disease, or just overall debilitation and serious illness. The PULST is a series of very specific questions regarding care if you are in a 911 situation, and it's something that patients have in their homes that they give to first responders, and it elucidates exactly what they can and can't do. And it's signed by a physician, and the patients have it, and so they use that. And that kind of is it's like a quick, easy healthcare directive. So it'll go through, I don't want CPR, I don't want to be intubated, I don't want a feeding tube. Has very specific and granular directions on the medical care that a patient would want. And those are very important for patients who have serious illness to have in their home, because if someone in the home and they're not, for example, enrolled in hospice, they call 911 and a first responder comes in. The first responder, particularly if the patient is unresponsive, the first thing the first responder will start doing is CPR. But if they have a pulsed form that says, do not, I want to die naturally, I don't want to have CPR, that will stop the first responder from proceeding down their algorithm of CPR. But if there's no pulse in the home, then the first responders, they're kind of obligated legally to begin CPR and resuscitation.